Welcome. I'm Pastor Cindy McDonald of Barnesville First United Methodist Church. We're fortunate to have Sean Parker and his family, who are members of our church. They live in Lamar County, and Sean is a healthcare worker in nearby Upson County. I've asked him to come and share with us a little bit about what he sees going on, the trends that he sees for COVID-19 in our area.
Yeah, I work two places. Monday through Thursday, I work at family practice, and we're probably testing an average 30, 40 people a day. Most of those are typically our patients. Some are patients of the surgeons that are doing pre-ops. And of course, if they're positive, then they can't have their surgery until they're cleared. Occasionally, we'll have some patients that become positive, and we've had some medical providers in the community in Thomaston that have been positive over the past couple of weeks. But on Fridays, I work at Upson Family Medical, which is on the north side, and it's a walk-in clinic. And they're testing probably 100 to 125 people every day because it's a rapid test. You can know within 15 minutes. And there are people coming as far away as Cherokee County, Alabama, Columbus, Georgia. And I know Friday I saw probably 25 to 30 people, and I know I had 10 of them positive. Now, some of those were people that walked in, probably 3 of them. So 7 of them were just people came in for symptoms. And most of them were symptomatic with just simple symptoms as, cough, congestion, shortness of breath. Some people had no symptoms at all, and they were all sick. But the one thing that I've also noticed over in Upson County that's kind of been the talk in some of the offices is the number of churches that have started back with relaxed, protocols. Some churches have no, wear a mask if you want to, don't wear a mask. One church, they're passing offering plate down the aisles, shaking hands, hugging. There's churches that are singing, and there's just been no changes like what recommendations like what the health and wellness team has recommended. And there's been some couple people in the churches that were positive, and it kind of started a little mini outbreak in Upson County. So, and because I asked a lot of the patients that I see, if they're in church and where they're going and how it's been, and some are, there's it's out there still. It's not going away. I'm not saying that Upson County is a hotbed and it's going to be one of the growing places in the central Georgia area, but it's there. And I think the other thing that's kind of interesting that we were talking yesterday is on Friday is I work with 18 people Monday through Thursday in one office and 18 people in the other office. We all wear a mask. We've been having to wear a mask since March, and only one of them has been positive. So the 36 people I've worked with, we've had only one positive, and she was positive in March because her pastor was positive, and he didn't know it when he preached the funeral that she was at. But since then, we've had no medical people in our offices positive, and I think one of the things is good hand washing, hygiene, and just wearing the mask. Now, I'm not going to say that next week we won't start having more positives, but it's, that's the one good thing is that we have to wear the mask, whether it's an N95 or a regular mask. And some of the nurses have bought their own masks to kind of have some colorful other than just the little plain blue or yellow ones. But, we're trying to do the best we can because we don't want to get sick and definitely don't want to try to get the patients sick as well.
Sean, what do you wish that people knew about the virus?
I wish that people would understand and recognize that it's there. I think it's, there's been a lot of patients I've seen that have been well in the sense that they've gotten it or contracted the virus and they've been able to get over within a week or so. There's been some patients that have contracted the virus, been fairly sick and wound up in the hospital. And but I just wish that people would understand it. It's out there. It's something that you could prevent. With just some simple things of good hygiene, social distancing, at the same time wearing the mask. Most of the people that I've seen that have contracted it have not been wearing their mask. They've not been social distancing. Just Friday, I had 3 people that were positive. It all was at the same get together last Saturday, and I asked them, I said, "Do y'all have a mask on?" No, we were just all sitting around with each other, talking, having a good time, and now all 3 of them are positive, and they all work, and they work at a facility in Thomaston that they've been at that job last week, and they were positive. And so the concern now is there are going to be more people because they work at a job where they don't have to wear a mask. And so it's just, a little bit of prevention, an ounce of prevention is worth a pound of cure. And so I just think if we can just, get this people to understand, let's do some prevention, wear the mask, good hygiene, social distance. Hopefully we can get this over with, because talking with some of the other providers in Upson community, we're concerned that, flu season is right around the corner. And if this is still going on with flu season, this is going to be a bad year. We're afraid.
Is there anything else you wish that people knew?
There's people I know out there, and there's people people I know that just think this is a big hoax, this conspiracy theory. And I've got patients that come in that we try to get them to wear a mask. We hand the mask out when they come in. We've got some people that will come or call. They come up to the parking lot and they will call. They don't want to come in until it's their time. Some people just refuse to wear the mask, and it's getting to the point that we've had to ask some people to leave if they were sick with symptoms and refuse to wear the mask, because you're not only putting everybody else at risk that's a patient that could be well, but you're putting us at increased risk. But I just, you're not going to be able to convince and change everybody. We just have to do the best we can. But I think it's starting to, sway some of the people. If you look in the news, that some of the, more notable people that at first thought it was just a naysay, either they become sick or had family members or close friends, and now they're realizing, hey, this is real. It's just not the plague of the 1900s or 1800s, but it's still there, and I don't think it's going away. They have over 15 people right now positive in the hospital. They're being treated, and they're local people. These are not people who have been brought in from outside hospitals. And talking with my sister, she said that 21 of the 22 people have been treated with one of these newer meds that it's very expensive, and it's working, but still there are patients that it's not working on. And I think it's almost like there's a strand out there now that's maybe not as bad as it was before. But 2 of the patients I saw Friday, it's like the nurses said, this is the old COVID virus strand, the ones that made the patients very sick, that had been very sick with fever and aches for like a week. So, we don't really know what's going on, and we've tried a lot of things, and we're trying to be preventative and treatment as much as possible, but it's just not going away anytime soon. And we've had young kids, and especially elderly adults, and anybody in between. And there's been patients that people that and patients that I know as well that have passed from it or symptoms related. So it's hit the home front, and I just hope it would go sooner than later, and let's get back to where we can get our lives normal. But I think, unfortunately, it's going to be with us for a little while longer.
John, what advice would you give to someone who finds the masks to be uncomfortable or difficult to wear?
I just wondered, it's kind of the latest thing I've noticed some people and I've seen is they wear some of these, it's kind of like it's a cloth that you can pull up that's maybe not quite as tight amongst the face. It's a little more breathable. It's a little bit looser to kind of help, because I know the worst ones that I've found is the N95s. Those are hot and you can't breathe. And there's been studies that say that even the ones with the 3M little filter, that those aren't good to wear because you can still get some particles in. We wear some simple masks that's fairly tight to the face. We've got some that we wear that are like what you'd wear in the OR that tied to the back. I've got some that wear that, and they even put a face shield on. But I think, trying to experiment and find something that fits, that covers the nose, covers the mouth, that provides the most protection, but with comfort at the same time. And it's something, and it's something you got to get used to. At first, I hated it. It was hot, it was miserable. But now, I get there at 8 o'clock, I put it on. I take it off occasionally, when I'm dictating charts through the microphone. Take it off, of course, when I'm eating. But, you just kind of get accustomed to it. Some of them are a little scratchy and irritable to the face, but, it's just one of those things that you get used to. And, if you know that it's going to help protect you, it's worth using. But I think, to tell somebody, and I've had to tell some patients, there's different types out there. You just got to try them and find the one that fits best for you. And when you do, just get several different of that variety. And that way you've got some different ones. I've noticed, like out at Country Oaks, I was out there yesterday, and they're selling one that you can slide over your head, and it's like almost like a neck warmer, but you can pull it up. And of course, it advertises Country Oaks, but it's something's better than nothing.
Good.
And I noticed, saying that, I noticed with, we're starting to get mail from Garrett, and we're able to get on the Facebook page, and all of those recruits, as well as the drill instructors, have to wear a mask. But it's sometimes they have those neck face shields that they wear. Of course, they're olive green, but every recruit in those pictures that we've seen on Facebook, they're wearing it. And there's been word that there's still COVID in some of those troops as well. So we're just, hoping to, they'll just keep wearing it, and hopefully they'll, stay healthy as well also.
Thank you. I hope that the things that you have shared will help people in our area safe.
This is what I see every day. And, and I think that, hopefully with just a little bit of prevention and just a little bit of ease of trying to use some preventative measures, that, maybe we can hopefully make a dent in this and get rid of it. Because, not only just so that we can get back to church and get our lives back to normal, hopefully just get this country back, because the longer that, people are out of jobs, it's like, I think it's touching us in all different ways. I was talking to Pam yesterday and was asking her if Mike having to wear a mask at his work, and says, no, he's furloughed. He's been furloughed for 3 months, and they're hoping that he will be able to go back next month. But he works at a job where what they do is not in a big need right now because of the shutdowns of businesses across this country. And so, it's a trickle down effect, and so their product is not in a big need. So the company doesn't need many employees. And so he's, at home. Luckily, he's getting some type of, money from being furloughed, but, they're like, for how much longer? How much longer am I going to be out? And so, we may not be sick, I may not know someone that's sick, but this COVID has affected each and every one of us in some ways. I was reading an article this morning. I know I'm rambling on to you, but just how everything trickles down. It's like there was an article written by a PA that says, they signed up to put their life on the line to help people, nurses, doctors, and all type of other providers. But they're also losing their jobs now, because in places where some of these hospitals, people aren't being seen. And just hopefully we can get this stuff cured and get everybody back to work and back healthy and back in church. And hopefully the country will get back to where it needs to be.
Thank you. Thank you.
You will.